Hi, everybody. I'm going to speak really fast to get through the top 100 patient experience. My name is Ben White. I'm the clinical director at MGH in Boston, and we're just going to talk about a few patient experience interventions that you might be able to bring back to your shop. In the spirit of a disclaimer, this is not a discussion of how to turn your ED into the Ritz-Carlton, but rather a brief summary of some of the literature and what we've learned over the last 15 years about the increased focus of patient experience in emergency medicine, and the fact that improving patient experience improves patient care, it improves compliance with your recommendations, it improves staff satisfaction and decreases burnout, and it reduces patient complaints and malpractice risk. And if that wasn't enough, there's also a new payer focus from CMS coming down the pike, where the EDPEC is going to ask your patients questions like, did they get care quickly? Did the doctor listen to you? And would you recommend this emergency department to your friends and family? And that's coming live in late 2018, we think. So the literature has taught us quite a lot about patient experience. These are a few of the themes that have been mentioned with increasing frequency over the last decade or so from a recent review of the literature. But I like to think about this in terms of the very simple equation for happiness, which is that happiness equals reality minus expectation multiplied by perspective. So think of yourself going to Disney World with your family, being really excited to go on the Small World ride and seeing this. And now picture yourself as a patient going to an emergency department and ask yourself, what would you expect? Would you expect to be treated kindly, to like your provider and nurse, to have your pain managed, to be kept informed about weights? And would you like some really basic human needs to be met? So that's what we're going to use to move into the next 10 interventions. Each slide will depict an intervention, and this is the audience response portion. So shout it out if you know what is coming next. So what's the first intervention? Cleaning, exactly. So you never get a second chance to make a first impression. And a clean ED absolutely improves the perception of care quality and is a really important intervention. How about this one? I can't hear you. Food, yeah. So hungry patients are angry patients, and there are many healthy options available. This one? All right, there we go. So it is amazing what a few warm blankets and a couple pillows can do to improve the perception of staff compassion. And they're cheap. How about this one? And no, it is not actually moving. So thinking about patient perception of care and weights is really important. Simple interventions like charging devices and providing distractions can be very low cost. How about this one? Right. So this is on every survey, and there are multiple different approaches, but a code pain approach can work really well and improve patient experience and care quality. How about this one? This one's a little trickier, but is incredibly important. So empathy and compassion are clearly linked to improved patient experience. There are plenty of models out there. If anybody wants to discuss after, I'm happy to go through them. How about this one? So this may be the single most important intervention in terms of improving patient experience, and it is a fundamental improvement in communication. Again, plenty of models and opportunities. How about this one? Pretty straightforward. This is one of my favorite slides. Decreasing wait time has a direct effect on improving patient experience, and lean methodologies work. How about this? They're getting trickier as we go on. So finishing strong. Discharge teaching is clearly correlated with improved patient experience and allows you to close your care episode on a good note. And finally, patient callbacks. So this requires some resources, but callback programs have been demonstrated to improve the likelihood to recommend the ED by 20%, which is a pretty significant improvement. So, in summary, focus on basic human needs like cleanliness, food, and comfort. Focus on perception and pain. Think about empathy and communication and how to improve them. Decrease wait times, finish strong, and consider a patient callback program. Thank you very much.